Good afternoon, Hattiesburg. It's Toby Barker. Thank you for joining us for this afternoon's briefing. I hope you all had a great weekend. It has not been the best of days here at City Hall with some news that have come out from the city, but we'll get to that in a second. We'll talk about today's numbers. We'll talk about the reduction in force that's going on in the city of Hattiesburg. We'll talk about the governor's Safer at Home executive order that took effect this morning, and of course our regular act of courage. So today's numbers, of course, reflect system-wide for our healthcare organizations. So, of course, Forest General serves 19 counties. Merit Health Wesley serves 18. And, of course, Semri and Hattiesburg Clinics serve several as well. As of this morning, 4,811 tests have been conducted. 567 of those have come back positive. Again, that is not Forest and Lamar counties alone. That's most of the Pine Belt that have come through our healthcare organizations. 3,981 have come back negative, and 263 are now pending. Of course, if we look at pending tests, this continues to be a positive trend for us. We used to have to wait several days to get tests back. Now we can get them either from the state lab or a private lab, or do them in-house and get them back very quickly, and that helps us as we try to get people into treatment and also preserve personal protective equipment. Our overall goals: first, protect the vulnerable populations. Those are people over the age of 60 and those who are with people who have underlying or chronic health conditions. Of course, our second goal is preventing the overrun of the healthcare system. So if you need healthcare, it will be there if and when you need it. Let's look at that second goal, and there are two metrics we look at, and these cause for concern. Right now, between Merit Health Wesley and Forest General, we have 40 people in the hospital, and that's well above the last 14-day average. That means it's not as high as we've been on Friday, but 40 is still a significant number. It's even more significant when you look at the number of ICU admissions. Right now we have 17 people in our two hospitals' ICUs. These are people with the most acute COVID-positive symptoms. These require a certain type of equipment. They require personnel with particular skill sets. And I want you to know that 17 is the highest number of ICU cases for COVID-19 since this all began. This causes some concern because ICU capacity, of course, is limited at both our hospitals. And what's even more true is that both hospitals still have their regular cases of heart attacks, strokes, car accidents, and other traumas. And so 17 in the ICU, when the average over the last 14 days has been 13, that does cause some concern. Our totals per county as of this morning: Forest County had 190, Lamar County had 92, for a total of 282 in the metro area. This is a graph. Of course, Lamar County is the orange line, Forest County is the blue line. Those combined are the gray line. You can see how those cases have gone up over time. But the one number we do look at is the 5-day average. This takes a particular day, it takes the 2 days prior, it takes the 2 days after. So you really have a better idea of where the trends are headed. And if you look at about April 15th, you saw our number of new cases, 5-day average, get to about 15. That's been the highest amount that it's been. Again, these are new cases. Then you started to see last week, at the beginning of the week, a drop in those cases. And so at one point, even Forest County got below Lamar County in terms of new cases. But what we saw at the end of the week is those numbers went right back up. You see a small dip there at the end. On Friday, we had, I think, 7 new cases. Saturday, we had 9 new cases. Yesterday, we had 0 new cases. But it was a Sunday, and so that means that there may not have been positive tests reported to the Department of Health, or the Department of Health may have tested a different batch of tests. And so that's why we use the 5-day average, so you don't really have, you don't put too much stock in sort of one-day test results. And so my message to you today is we have to be mindful of local data. I know that the talking points and the messages on social media or from state and national media are one thing. But what it really comes down to in our area is what's happening on the ground in Forest and Lamar counties. And the things that cause me concern is that our 5-day averages have gone back up since dropping since early last week. What else causes me concern are the fact that we have 40 people in the hospital and as many people in the ICU as we have right now. And so as we make decisions on when and how to reopen, we're going to make those based on local data. And right now, we're not seeing just overly optimistic trends in local data, even though we know that power is in our hands. And so the criteria that we use, that was given to us by the White House itself, here's kind of the gating criteria for when you move into phase 1 reopening and when you move from phase 1 to phase 2. And so you have symptoms, you have cases, you have hospitals. And in the cases, we're just not meeting that threshold right now, which is a downward trajectory of documented cases within a 14-day period. We saw an initial downward trajectory, but then it went right back up. We're also not seeing the percentage of positive tests as of total tests go down as well. We're actually seeing that creep up as well. And then in hospitals, of course, we have the highest amount yet in ICU cases. And so we'll be weighing heavily on this gating criteria, along some other things, as we decide when and how and when it's safe to reopen. So again, the idea here is just be mindful of local data. All right, one thing, some bad news that came out of City Hall today. Last week, we found out that our March sales tax revenue numbers were going to be well below where we were last year. And we knew this was sort of coming. We knew that from 10 to 15 days in March, we were at below capacity in terms of retail activity. We got an actual dollar amount to that late last week, and it appears we'll be between 15 and 16% under where we were in March of 2019. And understand that the city's budget is really dependent on sales tax dollars. We are the second largest sales tax producer in the state. It makes up a big portion of our overall revenue with which we run the city. The things we've tried to do, sort of seeing that this might be out there. In early March, we stopped all city-sponsored out-of-state travel for employees. We also froze hiring for general fund positions except for essential public safety personnel. But even with those steps, we believe we're going to be between 15 and 16% short in March. And if you take into account that April, almost the entirety of April was a shelter-in-place month, we expect that 15 to 16% to double for the month of April, and understanding that May may not rebound as quickly either. And so we're looking at a large sales tax shortfall going into the last 5 to 6 months of the fiscal year. So that's why we're doing a reduction in force. Our directors have been given criteria by which to weigh which positions to dissolve. And understand, this is hard for us. This crisis has challenged the city of Hattiesburg and our employees at a very personal level, from the health and life and safety of fellow employees to our families, and now it hits our economy, and now we have to make tough decisions. And while that's hard, and while we consider each other family, we have to maintain a balanced budget while also maintaining services and maintaining a strong fiscal position for the city of Hattiesburg. That is what our residents expect. And so with 6 months left in the fiscal year, this allows us to try and recoup some savings by doing this now. It also gives us an opportunity to avoid a second and third round of this reduction in force. And by also doing this now, we afford our employees who are let go to take advantage of enhanced unemployment benefits due to the CARES Act. And that is our pledge to our employees, is that we will do all that we can to take care of them if their position is dissolved during this process. And so, if you have questions about this, feel free to email us at mayor@hattiesburgms.com or reach out to us on social media. We've endeavored to be transparent with you and our employees throughout this entire process, and that will not, we will not diminish that effort just because the conversations and decisions get hard. All right, again, today is the first day of the Safer at Home order from Governor Reeves. This is a slight opening up from shelter in place. What is different now is that elective health surgeries are now available, and I know both our hospitals are working through how they're going to make that safe for the patients coming in. The other thing that's opened up is there is some in-store capacity for non-essential retail. These are clothing stores, bookstores, shoe stores. The city of Hattiesburg, even though the governor has opened up to in-store capacity to 50%, the city of Hattiesburg, based on our own local data that we are mindful of, has chosen a more tactful approach for what's good for us. And so we are doing in-store capacity by appointment only. Of course, that mirrors an executive order we issued back in March before shelter-in-place even took effect. That will guide us through the rest of this month. And as we approach the month of May, we will begin having conversations about where to go from here in terms of restrictions. But in-store non-essential retail can be done by appointment only in the city of Hattiesburg. And finally, our act of courage. And these have been very refreshing to so many in the community. And I want to spotlight West Point Baptist Church. Of course, you know, several of our school districts have feeding programs for public school kids, and actually any child under the age of 18, whether they go to that school system or not. And Hattiesburg Public Schools does Monday through Friday, but there is a gap for feeding on Saturdays, and West Point Baptist Church for the last several Saturdays has stepped up to not only feed Hattiesburg kids, but community kids from around the Pine Belt. They have had those grab-and-go meals at their church available, and they've also gone to places like Bassfield to feed those kids, understanding the challenges that that community has. And so to Pastor Kathy, to Tony and the team, thank you for being the hands and feet. We appreciate you taking care of our children. And as we go forward, please remember this week to wash your hands, take care of yourself. Please wear a mask if you go out in public. Masks are going to be part of our way of life for the next several months. And in fact, they could be one of the keys for us being able to reopen things faster. And finally, do only what is essential and stay home. And I know that things are up and down right now, and I know today has been a tough day, but I remind you, courage.